Hello students, myself Dr. Maddineni Srinivas. I discuss dermatology related MCQs and this is today's MCQ. A 5-month-old baby was brought to the dermatology OPD with complaint of golden color rash over scalp which was diagnosed as cradle cap. That is in short cradle cap dermatitis, which is nothing but seborrheic dermatitis which is seen in children, infants. And for this they salicylic acid based anti-dandruff shampoo was given. Why? Because salicylic acid is a keratolytic agent which is used in seborrheic dermatitis. So now senior consultant sends the patient to pediatric OPD. So from the dermatology department the child is gone into pediatric OPD, and in the pediatric OPD there was a suspicion that this child may be having some vitamin deficiency. So what is the most likely vitamin deficient in this child? Simply the question is trying to tell you that this child is having seborrheic dermatitis like features, sebderm. And can you tell me what are the vitamins which if become deficient will result in seborrheic dermatitis like features? And if you have marked the answer as option C, that is vitamin B2, absolutely right. And I will tell you one more vitamin whose deficiency can cause seborrheic dermatitis like features, and it is vitamin B7, which is also called as vitamin H. There is one more name for this vitamin. If you know the answer for this question, leave the answer in the comment section. So let us see what are the other vitamins and their complications manifesting as. So vitamin A deficiency, it is going to manifest as Frenoderma. Frenoderma is basically follicular papules will be there with central keratotic plug which will be seen over the extensor surface of the extremities. Whereas vitamin B1 deficiency, if you remember, very important from biochemistry point of view, berry, wet berry and dry berry. Of course, in dermatology, what you need to remember is there will be glossitis as an important manifestation of vitamin B1 deficiency, that is thiamine deficiency. And vitamin C ascorbic acid deficiency will manifest dermatologically as perifollicular hemorrhages and corkscrew hairs. So these are the two important things which you must remember: perifollicular hemorrhages and corkscrew hairs. Okay, so now let us quickly see what are the manifestations. So as I have told you, vitamin A, so just follow the highlighter. So vitamin A, retinol, Frenoderma, and yes, vitamin B1 thiamine deficiency results in yes, berry, wet and dry berry. I hope you all do remember Korsakoff-Wernicke's syndrome. So in the skin and mucous membrane, just remember glossitis and glossodynia. Okay, that is inflammation of the tongue. And vitamin B2, that is riboflavin deficiency. This is the most important thing. Yes, seborrheic dermatitis like lesions. This was the MCQ which was asked. So basically here periorificial sites are going to show scaly papules and ulcers and fissurings. And also one more point which you must observe here carefully is conjunctivitis. Even this is also important. Why? Because like for example, this is a pediatric dermatology integrated question. They can ask you dermatology and ophthalmology integrated question based upon these nutritional deficiencies. And this is a very famous question, niacin deficiency, vitamin B3 deficiency, and there is one appearance which is characteristically given for this deficiency. If you know the answer for this, leave your answer in the comment section below. What is this called as? This is called as one necklace appearance. Type in your answer in the comment section. And vitamin C deficiency, as I have told you, corkscrew hairs will be there, and there is going to be hemorrhages which can be seen perifollicular. If you wish